Hi, this is Dr. Chad Larson. Thanks for joining me in another episode of Keep It Real. Did you know that there's over 200,000 stroke cases per year? Which is a very, very high number. So what's a stroke? A stroke is a sudden loss of blood flow to a certain part of the brain. And depending on what blood vessel is clogged will affect a certain part of the brain, and there'll be very, very acute symptoms that follow that. And so there's an acronym that I want you to remember, FAST, because you have to think fast when any of these symptoms manifest in either yourself or someone you're with. And the F is facial weakness or facial slumping or facial drooping. And this happens very suddenly, and that's an emergency situation. The A is arm weakness. If there's sudden loss of function of the arm, that's an emergency situation. You got to get to the hospital right away. The S is slurred speech. It's another common cause, let's say common symptom of a stroke. There's a certain part of the brain that is where the speech centers are, and if there's a sudden loss of blood flow to that area of the brain, there can be a sudden onset of slurred speech. And the T is time to call 911, FAST, because there's a very short period of time that you have to get to the hospital and get the proper acute treatment, because most strokes are ischemic strokes, which means that there's a clot that's blocking the artery that's supplying that part of the brain. The other type is hemorrhagic. It's not as common, but it happens frequently as well. So these ischemic strokes need to be treated right away within hours, so that they could administer the proper clot busting medication to help try and increase the chance of preserving that area of the brain. And so that's what happens at the onset of a stroke. But let's talk about preventing a stroke. And there's a few things that we know of that are risk factors for stroke. So if you have one of these things, or if you're interested in decreasing the chance of a stroke, then here's the things you want to think about. And at the end, I'm going to tell you about something that you might be doing every single day that is tripling your risk of developing a stroke. Okay, so number one is high blood pressure. We know that elevated blood pressure is a significant risk factor for stroke, because there's extra pressure that's being put in the circulatory system, and when that happens, there can be damage to the blood vessels. A clot can form, go up to the brain, and cause a stroke. High cholesterol, and I'd say more specifically, high oxidized cholesterol. High cholesterol by itself is one thing; it's a bit of a risk factor, but when the cholesterol is oxidized, then that's a much bigger issue. That could start to clog up blood vessels, and when blood vessels are clogged, sometimes they get nicked and damaged. A clot forms to try and cinch that off, and that clot could become unstable and get loose and go up to the brain and cause a stroke. So what we need to quench the oxidation of your cholesterol is antioxidants. And that's where, all your fruits and vegetables and berries all have different colors. All those colors are antioxidants. And that's why you need to have 5 to 9 servings of fruits and vegetables every day. And that's your antioxidants to help block that kind of oxidative damage. Another one is high blood sugar, particularly in diabetes. Diabetes, we know, is a condition that increases your chance significantly of getting a stroke. And high blood sugar is very inflammatory for the system and can cause inflammation, blood clot, and that could be a problem. Another one is atrial fibrillation, or Afib. Afib is a abnormal beating of the heart. We call it arrhythmia. And so when a person has arrhythmia, the blood kind of pools and spins around in the heart before it's fully ejected. And when that happens, when the blood's kind of spinning around in there, a little clot can form, and then the heart beats, and it could send a clot up to the brain and suddenly cause a stroke. So Afib is a key risk factor for getting a stroke. So if you happen to have those issues, then you really might want to make sure and take care of those to decrease your chance of getting a stroke. But there is a very recent study, like very recent, that was published in the journal called Stroke, which is one of the official journals of the American Heart Association. And what they found out, they did a very large population study, and they looked at multiple factors. And one of the factors that they looked at was diet sodas. If you drink just one diet soda per day, you will triple your risk for developing a stroke. Triple. Just one diet soda a day. So what's in the diet soda? There's typically one or two, let's say one or more of these artificial sugars, these artificial sweeteners in diet soda. Real quick on diet soda. Diet soda has nothing to do with fat loss or weight loss. It's a total marketing gimmick. In fact, there's studies that show that it can increase insulin resistance. It could increase fat gain. So don't buy into the diet theory of diet soda. It's just complete junk marketing, and it's only doing you harm. It's doing you absolutely no good whatsoever. So these artificial sweeteners, some of them you probably heard of: aspartame, sucralose, saccharin, and acesulfame. And it's usually one or more of these four common artificial sweeteners. And these are just some of the worst products of human food manufacturing that we have out there. Another one that you find in sodas, which wouldn't be in a diet soda, but it's just another type of sugar or sweetener, and that's high fructose corn syrup. That's also hideous stuff that's been shown to increase the chance of diabetes and things like that. But they tested also in this study regular good old cane sugar sweetened sodas, and that did not increase the chance of a stroke. So those are getting harder and harder to find. Most sodas either have one of these artificial sweeteners or they have high fructose corn syrup. But you know, if you have to have a soda, have one with good old-fashioned cane sugar without these artificial sweeteners, because your body actually knows what to do with cane sugar, but these artificial sweeteners are just chemicals that your body really doesn't know what to do with. And now we know it can triple your risk of developing a stroke. So there's something to keep in mind. Strokes are very difficult conditions. I've helped patients in brain rehab from stroke, and it's just absolutely grueling work. And that's if you're lucky. If you're a survivor of stroke, you're lucky. And it's really grueling work to do the proper rehab to try and restore the brain. So trust me, you really want to do everything you can to decrease the chance of developing a stroke. And so no more diet sodas. It's just absolute junk, and you need to stay away from it at all possible. There's lots of other replacements that you can have, but just don't have diet soda. And this is very recent published literature. And so I'm going to keep reading the literature and keep reporting it to you, and I hope you get a little healthier every time. So we'll see you next time. Keep it real.